Hello, everyone. Our topic today is academic nursing in Israel, a vital and changing component of the Israeli healthcare system. I'm Bruce Rosen from Israel Healthcare Highlights, and my special guest today is Professor Efrat Shadmi, who's the director of the School of Nursing at Haifa University and also one of Israel's leading health services researchers. Hi, Efrat.
Hello, Bruce. Thank you for having me, and thank you for this amazing and thoughtful series that you're arranging. So I'm glad to be part of it.
Great. So please tell everyone a bit about your background.
So I'm a nurse. I'm actually a graduate of the first class of nursing of our school, which I will be incoming dean coming this October, the School of Nursing at the University of Haifa. I have had the privilege to study for my PhD at the Johns Hopkins School of Public Health with a very unique scholarship for faculty development that was awarded by my university and as a Fulbright scholar. Upon completing my PhD in health services research and health policy, I came back to our School of Nursing, and since then, since 2005, I'm a faculty member, currently a full professor at our department. I also had some experience as the co-editor-in-chief of the International Journal for Equity in Health for 11 years. And currently I'm associate editor at that journal. And I have been consulting for Clalit Health Services, the innovation division, the health policy department for many years now.
Okay, before we go on, I'll just add that Efrat has authored some of the most cited academic articles in Israeli healthcare. Efrat, could you please tell us a bit about the development of nursing education over the years in Israel and where we currently stand?
Sure. So we are at a very, I think, important point at the evolution of nursing education. Actually, date back more than 100 years ago, 1918. So yes, more than 100 years ago, that the first School of Nursing was established by the Zionist Hadassah movement in Henrietta Salt that established also the basically the infrastructure for our public health system, the drop of milk services that gave immunization and well baby checkups and support for new mothers as part of kind of the establishment of what later became the Israeli healthcare system. So the Hadassah movement brought in nurses from the United States, and they established the first school at Hadassah, and gradually more school and other training programs evolved. And importantly, around 1960s, the first academic program at the Tel Aviv University was opened by former Hadassah nurses and academics. After that, also programs at Ben Gurion University and the Hebrew University. So we have around the 1960s, 70s, the first establishment of baccalaureate or Bachelor of Science programs with RN registered nurse degrees in academic nursing programs alongside license practice 2-year programs and registered nurse 3-year programs in various hospitals and nursing schools. The next kind of big leap is 1995. So only in about 30 years, more than 30 years after the establishment of these first academic programs, our program at the Department of Nursing at Haifa opened. And this probably raises a question, why did it take so many years for a program to open in the north of the country? So part of the reason has kind of to do with the history of our healthcare system and the evolution of medical and nursing education in Israel. And it used to be that nursing schools had to be under, academic nursing schools had to be under the auspices of faculties of medicine. In Haifa, we have kind of a unique situation. We have the Technion Institute, a very prestigious institute that has had for many years now the Faculty of Medicine, and the Haifa University, which holds the social sciences and what began as kind of the health and welfare professions. So 1995, there had to be kind of a new model, and the University of Haifa actually joined forces with the Technion to establish the first academic program in the north, and I had the privilege to be part of that first class and eventually graduate from our program. It took some years, and other programs opened also in colleges, and this demand that nursing be part of medicine was it didn't exist anymore. It was dropped as a requirement, and the programs also opened in colleges and other universities, like and more recently, Azrieli University has a program and others. So nursing became, throughout the years, more independent academically. At the bachelorette level, there are currently only bachelorette registered nurse programs. So throughout the years, the Ministry of Health and Nursing Division slowly closed all the licensure and registered nurse programs. And today we have nursing training only as part of colleges or universities in Israel, as part of four-year programs, and more recently as part of accelerated 2.5-year programs for people who already hold an academic degree. So this is kind of at the more basic level.
What about doctorates in nursing? I think that's really grown in recent decades. Do I understand that correctly?
Sure. So the profession and the academic evolution of nursing in Israel is progressing, and there are, of course, I think more than 15 years now, already established graduate level, master level programs. As well as in 2015, our school opened the first PhD program for nurses. So if you go back, and there had to be these type of innovative solutions, like the program I participated in for nurses to study abroad and come back as PhD prepared nurses. Since 2015, in our school, we have the first independent PhD program for nurses, actually trained more than 40 nurses throughout the years. And we're not the only one. So there are programs also in Tel Aviv and in other disciplines that nurses have PhDs in similar disciplines or adjacent allied professions. But nursing as a academic discipline is quite young in terms of the PhD program. This creates a challenge because we need the research and the PhD prepared nurses to prepare the next generation of academic nurses and to help grow the academic support and oversight for the programs. And currently we have quite a unique situation in Israel. We have very, I think, important and quite exciting initiative by the Ministry of Health. The nursing division since 2013 is developing, establishing the nurse practitioner. Nurse practitioner programs or prepared nurses are those that have a graduate degree, experience in a specific field, and they receive specific training and certification to provide prescriptions, refer patients, and provide some types of medical authorities as prescribed, as they're certified. So, for example, we have in palliative care, in geriatrics, in diabetes, in surgery. So currently there are, I think, more than 17 areas where there are nurse practitioners, mainly trained through courses in the Ministry of Health.
That's terrific. I mean, that development is so important both for the nursing profession as well as for patients and the healthcare system. It's a great thing, and I know it wasn't an easy path in the early years. I'd now like to turn to the great development you've had at your university. I know you've been a central player there of this huge gift that the university got to establish an advanced nursing center. Could you tell us a bit about that?
So yes, thank you. This is indeed very exciting. We have received a very generous donation from the Azrieli Foundation to form the Azrieli Advanced Nursing Center. This center is really, I think, an example of how academic nursing can really support, empower, and help develop the advanced practice nursing in Israel. As I mentioned, this very exciting recently new initiative of the Ministry of Health to develop the nurse practitioner program is usually provided within specific courses by the Ministry of Health. I'm saying this kind of to explain a little bit why we have established the Advanced Center. So this creates a bit of strange, I would say, situation in which academic bachelor undergraduate education in Israel is kind of obsolete. So there are only undergraduate registered nurse programs. You can only study nursing in academic environments in Israel. However, at the graduate level, mainly the courses are provided by the Ministry of Health. In our school, we have one of the only programs, there are very few in Israel, that is part of graduate level and professional advanced course. We have a program in nurse practitioner in palliative care. This is end of life or symptom support. The nurses are really provided these special authorities to provide palliative care to patients in need, together with a master degree. The Advanced Center was kind of established to help bridge a little bit about this disconnect. In my view, we need professional nursing also to be at high academic standards and with the support that academia can provide with advanced research. Programs that kind of have to push nurses more into innovation, into this health tech environment. And Azrieli Foundation really acknowledged this and provided us with a unique donation of $10 million to establish a center that will have a simulation center, a research center, and a technology development unit, all working together to help provide advanced training, provide the support for research to help nurses be more acknowledged and trained, and kind of in this research world, as we know, there are great advances for nursing research in Israel.
That's terrific. And I really want to say kudos to the Azrieli Foundation for this forward-looking support. And of course, it's a great recognition of Haifa University, of your faculty, of your school, and of you personally. So this is really a great moment. Before we wrap up, is there any parting words you'd like to leave with our audience?
Yes, so thank you. This is really kind of a walk down history. So we started more than 100 years ago with the evolution of nursing as a profession that was leading some of the important advances in healthcare in Israel, like the public health services. And today, I think we are charged with continuing to lead the healthcare system in Israel. We have this great challenges, of course, with the current situation, with the health, mental health of our population, but also specifically nursing. We have a very severe shortage of nurses. And a center like Advance and programs that I think can really be pushed forward by academia can really boost the profession. We can hopefully attract more young and enthusiastic people to the profession and help bridge all the parts that are kind of still in need for support, like disparities in health, mental health, care for the older adults, chronic disease, through our research. And just maybe to wrap up with one example, if I may, I think this provides a very unique example of how academic nursing research and practice can work together. Currently with colleagues at our School of Social Work and with the Bar Ilan University Psychology Department, we are putting together with Rambam Nursing Division and their allied health professions a program to help identify patients that come to the hospital for kind of any type of reason, medical reason, but are actually affected by trauma. So we developed together with Rambam an identification system, a survey that is administered by nurses that have received unique training to accompany these patients, provide with them adequate care that is related to their needs. And this is all kind of with an oversight of a nurse practitioner in mental health, a new role that is installed in nursing division in Rambam. So we have this academic vision oversight together with the need, together with the teams at Rambam Medical Center, all this accompanied by research so we can learn from it. And I think it provides us, just one example of many, how collaborations between academia and practice can really work to make a difference.
Well, that's been great. Professor Efrat Shadmi, thank you so much for joining us today.
Thank you, and goodbye.